Welcome to Cancer Newsline, a podcast series from the University of Texas MD Anderson Cancer Center. Cancer Newsline helps you stay current with the news on cancer research, diagnosis, treatment, and prevention, providing the latest information on reducing your family's cancer risk. I'm your host, Lisa Garvin, and today we have two guests, Dr. Lois Ramondetta, who is a professor of gynecologic oncology and also works at LBJ in MD Anderson's name, and Dr. Erich Sturgis, who is a professor of head and neck surgery here at MD Anderson. Today we're going to be talking about the Human Papillomavirus, which is a sexually transmitted disease of 40 different types that increasingly has had links to several different types of cancers. Dr. Ramondetta, as a gynecologic oncologist, obviously you're seeing a lot of people with cervical cancer. It seems that the evidence is pretty irrefutable now that these HPV vaccines can prevent like up to 90% of these cancers.
So what that's based on is the fact that HPV is known to cause a couple of steps towards the cervical cancer. So HPV can cause a precancer of the cervix as well as vaginal and vulvar warts. And we have already seen, especially in countries that are doing better jobs than we are in vaccinating their kids, a significant decrease in these precursors and in the warts. The vaccines that are out now will prevent about 70% of the cervix cancers that are out there. But we expect with the newer vaccine coming out later this year that we may be able to prevent up to 90%.
And other gynecological cancers also have a high rate of causation with HPV viruses, correct? I mean, like cervical, not cervical, that's the obvious one.
Vaginal, vulvar, and cervical.
And so some of them, like I had read that like about 69% of vulvar cancers may be caused by an HPV virus.
Correct. And what's the bigger concern, even more so, we do have a lot of cervix cancer, and it's a terrible thing when it happens because you could have prevented it. But the expense and the time and the distress that the treatment and diagnosis of the precancers cause is really one of the biggest health problems and health resource allocation problems that we have in the United States today, meaning that if you're diagnosed with an abnormal pap smear or a vaginal wart, you end up having repeated visits and minor surgeries that can lead even to issues with pregnancy loss. And this is even before being diagnosed with the cancer.
And as we've moved on, at first, Gardasil, I believe, was the first vaccine to come out, and the focus was on young girls. But now it appears that boys can also benefit from an HPV vaccine. And Dr. Sturgis, you want to address that one?
Yes, I would say that for my area, the most common cancer-related HPV would be of the oropharynx, so the tonsils and the base of the tongue, the very back part of the tongue, which you cannot see. About 3/4 of these are attributable to HPV, and we have now data that supports that the vaccines do reduce the prevalence of oral infection. So it'll be many years before we actually show proof that prevents cancer, but certainly the infection is the first step on that path to cancer, and we have good evidence now that it prevents infection. So these are mostly cancers that occur in middle-aged men more than women, and it's actually at this point in time there's more oropharyngeal cancers each year in the United States than there are cervical cancers.
When was that connection made between HPV and oropharyngeal tumors?
It started back in the 90s, but really the conclusive studies were in the early 2000s.
And the thing with HPV is a lot of people, how many people would you say carry one version or more of HPV?
For genital HPV, it's pretty well accepted that both men and women, about 80% will have an infection at some point in their life. Most of those are cleared over a 2-year period naturally, but certainly not all. And for oral prevalence rates, we don't fully have as extensive data as we do for genital infection, but somewhere around, at any one point in time, somewhere around 10 to 15% of men will have an oral infection, and about 5 to 10% of women will have an oral infection.
And that's more like 20+% for at any one time women having an HPV infection at any one time. 20% of the U.S. population will be infected.
But most people typically don't see symptoms, as you say.
That's right. And we don't know why some people have the virus stick around longer. There are some ideas. Some of them might be immunosuppression. So people who maybe were transplant patients or people who take chronic steroids, and smokers tend to keep those infections longer. But we don't know which one of those people who got exposed is going to end up with a precancer and then eventual cancer. And just to give you an idea, there are actually, even in Texas alone, over 1,000 cases yearly of cervix cancer. And this is just in Texas. And again, the concept is this is really unique. We actually have a great, we know what causes cervix cancer. We know how to prevent it by not being exposed. We know that the vaccine can prevent the infection. And we know how to find it with early stages. And this is really unique to any other cancer type. And in fact, stands out even with the whole oropharyngeal issue is that they are at a disadvantage because there is no screening test. So the issue is, if you want to play, you want to gamble and assume you're not going to be one of those people who get the cancer related to the infection, then you can do that. But we actually know that we can reduce the infection if we give you the vaccine.
And from what I understand, the success of these vaccines really far outstrips some of the more normal vaccines we think of, like flu and whooping cough. And the success rates are phenomenal for these.
Certainly for the efficacy of the vaccine is certainly higher than, say, a standard flu shot at preventing infection.
But the key is that you have to get it as a prevention. And you have to get it as early as you can. So again, the recommendations are age 11 and 12, boys and girls. And the reason for that is it's preventative, so most likely they have not been exposed. And number two, their immune systems are going to remember this immunity that they need to have against HPV much longer than if you give it to somebody older.
And as vaccines go, this is a fairly short window. So you have to kind of get it between 11 and 21 if you're a man and 11 and 26 if you're a woman. So once you get past your mid-20s, it's not effective.
Well, let's make sure we get that clear. The recommendation from the CDC is to get it at age 11 and 12. So the highest infection rates are in the teens and 20s. So we want to get the vaccine before the infection. What they call catch-up vaccination is recommended for people for women who are 26 and under. They should be vaccinated if they didn't get it when they were 11 or 12. And for men and boys up to age 21, they should, even if they're past that time they should have gotten it, they should go back and get a catch-up vaccination.
And I do know there's been a public awareness crisis with Gardasil. In particular, I know here in Texas in 2007, our governor, Rick Perry, signed an executive order for whatever reasons to make all girls in sixth grade get this vaccination, which it was quickly overturned. But it was used as kind of a political football. How does that make y'all feel when you've got something that works, but yet there are so many people using it as a rock to throw at others?
I think it's a tragedy. I think it's very upsetting, makes me very angry that this has at all become political. We do feel like this is a medical breakthrough, that it is the first time that we have a vaccine that can prevent cancer, and we'd really like to make the most of it. And, seeing any patient with cancer is a terrible thing. You always feel bad about it, but we don't know what causes most cancers. With this one, to know that you could have prevented it by vaccinating the patient, it's just unacceptable and honestly morally wrong to not use this, everything that we have in our power to prevent our kids from getting cancer.
Because, as someone used the scenario that if you had a blue pill that you could give to people and say, hey, this prevents X type of cancer, would you take it? Most people would say yes.
Yes, absolutely. And the truth is that there's a lot of rumors out there. There's a lot of people who believe things that they read on the internet, but there has been extensive safety evaluations of the vaccines. They're easy to access, they're easy to look at, and there have been large cohort studies that have looked at whether or not there was any increase in even specific issues. Like, for instance, there was a concern at some point that the vaccines were related to a neurologic abnormality or an immunologic abnormality, and large studies have been done and show no effective correlation.
So how do you take this to the next level? I mean, obviously there has to be some sort of public awareness campaign, or how do we educate people and how do we get it to become part of the pantheon of vaccines that people get?
Well, I mean, I think for one, we know that, or we now understand that most of the hesitance to get the vaccine from parents has to do with essentially a lack of knowledge, either by their pediatrician, the provider for the children, or a lack of knowledge in the parents themselves that say these vaccines were even understood that they were needed to prevent cancer. So that gives us an opportunity. We certainly can do shows like this so we can make people aware that it's important that their kids get vaccinated to prevent these cancers. And also educate those that have this misconception that somehow there's a safety issue for these vaccines. I think the good news is from state legislatures around the country, things are moving forward and not backward as far as making these vaccines more available, adding in some mandatory opportunities for middle school students and what have you. So I think some of the initial fear-mongering about this vaccine is starting to subside, and I think we're headed in the right direction.
I think the one other opportunity that we have is to approach the education from a different standpoint, and that's one place where I think MD Anderson and other cancer centers play a unique role. This vaccine, as you said, was initially brought out as a way to prevent cervix cancer, as a way of preventing a sexually transmitted disease. But what we're really talking about, and what we have the opportunity to do, especially with cancer centers joining together through some efforts of the CDC and the NCI, is to join together and to talk about this as an anti-cancer vaccine, which it is. And this opportunity for us to come together, which we have already started to do. We had a recent meeting amongst cancer centers who are all working to understand what's working and not in their particular states, plus the new FDA approval of the newest HPV vaccine, which doesn't have a name yet, but the HPV-9 vaccine, which will cover 9 different HPV types, and it's expected to be much more effective than the other 2 that are out there. It gives us the opportunity to really try to get this education out there as a cancer center, not as a gynecologist or specifically as a pediatrician, but to take what we know about the downstream effects of an HPV cancer and teach both providers and the public about what could happen if you don't get vaccinated.
And just in glancing over some figures before I came to talk to y'all, they said, ballpark figures, of course, that about 20,000 cancers a year in women are HPV-related, and anywhere from 10 to 12,000 male cancers are HPV-related. So are those numbers increasing, or what is...
Well, certainly for... it's even more than that, I would say. So we have to remember that there's somewhere between 1 million, 1.5 million new cervical premalignancies every year. That's a huge number. And there's about 1 million new cases of genital warts every year just in this country. So those are tremendous public health effects. The oropharyngeal site for HPV cancers is increasing in numbers. For men, it's about 5% increased every single year, that's in the range, or actually a little more than the increasing rates of melanoma that we're seeing in this country. For anal cancer, for vulvar cancer, these 2 sites, for whatever reason, are also increasing in numbers each year in the United States. So while we can screen for cervical cancer, some of these other sites, which are either rare, like vulvar or anal cancer, or hard to screen. In other words, the site is hard to examine. We cannot see these premalignant changes like the oropharynx. We're going to have increasing problems until these 11-year-old kids nowadays are reaching their middle-age years. So we got, 3 decades of a problem ahead of us, and we need to get these vaccination rates up as quickly as possible.
And we are so behind in comparison to almost all other countries. And just to give you an idea and some numbers, we're vaccinating for girls with the 3 series. Only about 30% of our girls are getting the 3 series, and less than 10% of the boys are getting the 3 series. In comparison to Australia, which is vaccinating about 75% of their kids, United Kingdom doing between 80 and 90%. And I have to mention Rwanda, who is also vaccinating 93% of their girls and boys.
Wow.
So it's just the fact that politics have played a role in protecting our kids is just incredible. And I just want to stress, because we didn't mention anal cancer before, but we believe 90+% of anal cancers are HPV related.
Let's tick off the list of HPV related cancers. We've got cervical, of course, which was the one that started it all. What other cancers have that causational link?
I think we've gone through them, but it's cervix, oropharyngeal, vulvar, vaginal, anal, and penile.
Oh, penile cancer. And I think
Not all of them. I think it's more like 40 to 50%.
which is a rare. Yeah, I saw 63% as a figure, and even that's pretty high for a rare cancer. I also read too that I think it's Gardasil that is actually good for men with compromised immune systems and gay men who are sexually active gay men. Is this true?
Well, as we said, we don't really know who is going to get that HPV virus that sticks with them. We do know certain activities that may increase your risk of getting it, and that's really one being human and having an intimate relationship and having multiple partners. But as we said, 80% of us are going to get exposed. The question is, of those people who are exposed, who are going to be the unlucky ones? Let's say like the flu. Who is going to be in contact with, shake someone's hand with the flu and get the flu? You don't know. But certain things make you at more risk. So with HPV, it's being immunosuppressed. That's definitely one of them. That's a small percentage, but those people are more likely to get the warts, to get the cancers. People who smoke are more likely to get any of those cancers related to HPV, and transplant patients, people who take chronic steroids.
I do know that HPV is going to be a focus for MD Anderson going forward. Tell us what that roadmap is. What are we going to be doing as we focus? You have a center of excellence that's opening up and some research dollars coming in. What's your roadmap for the next couple of years?
Well, I think the main thing that we are doing is that we are a center that deals with so many specialties that deal with HPV-related cancers that we're realizing our unique position to come together to work to, one, increase vaccination, but also treat these. And Erich is leading our pilot in this area, and I'll let him talk about that. And we hope that this is just the beginning of many years of working in this field.
So, I mean, I think Lois, touched on the central theme of this is bringing together, rather than attacking this disease from each of our individual disease sites, we're coming together across disease sites. So GYN oncologists, GI oncologists that deal with anal cancer, colorectal surgeons that deal with anal cancer, GU surgeons and GU oncologists that deal with penile cancer, and then head and neck surgeons, head and neck oncologists, head and neck and GYN radiation oncologists as well, to sort of approach this as a singular disease. Really, I mean, the prevention of this is a singular force. I mean, getting kids vaccinated. And the more we talk about that as a group, I think the better, or the greater impact we'll have with parents, with state legislatures, and with the public to try to get our kids vaccinated. And so our president, Dr. DePino, has really recognized this opportunity for MD Anderson to sort of have the bully pulpit on this and speak out on this, and has, along with an executive committee, chosen us for a pilot moonshot with a 1-year funding to support this effort. Lois is leading the education and policy effort, and we have an effort devoted to prevention and screening, and then we have some novel therapy and novel clinical trial efforts that are being led through the 3 different disease site groups. And we're very excited with this. We've got some early success, particularly in this outreach about vaccination. And the next step will be trying to establish a more prolonged effort to address HPV cancers as a group.
Dr. Ramondetta, if you could sum this up in one sentence that you could tell the world, what would you say about HPV vaccines?
Don't wait, vaccinate.
Great. Thank you both very much.
You're welcome.
Happy to be here.
If you have questions about anything you've heard today on Cancer Newsline, contact Ask MD Anderson at 1-877-MDA-6789 or online at mdanderson.org/ask. Thank you for listening to this episode of Cancer Newsline. Tune in for the next podcast in our series.